and wellness with business health solutions at Prisma Health. And we are in our bi-weekly now COVID and wellness updates. Today is May 7th. Luckily, information isn't changing too quickly, so shouldn't be too out of date by the time you hear this. But of course, remember that could change at any moment. South Carolina is looking pretty good, a little bit of an uptick on that percent positive, depending on the resource that you check. It's somewhere between 4.7 and 5.4, so around that 5% mark, which is a little bit higher than we were seeing before, but still keeping in those low numbers. We have sort of shifted a couple of the high-risk counties around, so we still have 4 high-risk counties in South Carolina with more than 200 cases per 100,000 folks in those counties. But they're a little different than they were the last time we talked. So we can tell that the disease burden is low and has remained low in South Carolina, but that there are outbreaks kind of shifting around around the state. Now, I want to spend some time talking to you all about the different perspectives that different organizations and different groups of folks have on this pandemic and why it's so difficult to tease out the emerging recommendations, especially now that we see more and more folks getting vaccinated. So maybe this will help you as you're developing policies for your workforce as we move forward through this pandemic towards a foreseeable end, hopefully, and be able to navigate some of the nuances that are going on right now. We're really in a transition phase, a good one, as we transition into much lower disease burden and much higher number of folks who are vaccinated, but it's making some of those recommendations murky. So what I want you to realize is that the public health sector defines what an epidemic and a pandemic is, and they're looking at this as a disease burden that has spread, and their goal is to decrease the numbers so that transmission of the coronavirus is as low as possible, right? Pretty straightforward. And so that's what we're going for, right? The next way I want you to look at this is healthcare systems. Their goal is to try to get their communities that they serve to decrease the disease burden so that they can cater to the healthcare needs of not only our COVID patients, but everyone else. And so it's very much around, oh my goodness, are we overwhelming our resources? Now, luckily in South Carolina, that never happened to an alarming degree. But of course, we think about countries like India that are really struggling in that area. Then you have clinicians like myself, and we want those numbers to get lower and that disease burden to get lower because we want you to be healthy. We want you to feel safe. We do not want to see serious consequences of COVID. We do not want our patients to die. And then finally, there's you and your perspective. And of course, you want to see these numbers go down as individuals and as employers, because you want to be sure that your workforce, yourself, your family, your friends are all healthy and safe, and also so that we can begin to get back to the things that we have missed and doing them in the way that we were used to doing them before. I really want to reemphasize here that folks who believe that this cannot impact them, in other words, well, I'm healthy, I'm young, I'm not going to get COVID, I'm not going to have severe consequences from COVID, they need to be really thinking about what's been happening over the last few months. High risk older folks have gotten vaccinated, and yet this virus still wants to spread as much as it can. If it can infect a high risk older folk person because they've been vaccinated, who's it going to land on? It's going to be our young people. And we are seeing more and more young people suffering severe consequences from COVID, even death, ending up in the ICU, suffering from long haul syndrome, which is symptoms that last even up to 6 months following COVID, in our young people, because this is where the virus can attack now. So those of you who have portions of your workforce who may have some vaccine apathy because they feel like they're not the high risk population, part of that high risk population, it may be worth having them understand that the high risk population has been taken out of the equation for the most part, thanks to vaccination. And that allows that COVID vaccine to land on our younger folks now. So getting vaccinated for these people is just as important as it is for anyone who is high risk or older. So let's talk about what it means if you get vaccinated and what kind of freedoms you may have that are a little different from those who are not vaccinated. And when I say freedoms, I really mean psychological. Certainly, we're not trying to say folks who've been vaccinated can do this and folks who can't do that. It's really around using common sense and knowing what's going to put you at the lowest risk and keep others safe as well. So if you have been vaccinated or portions of your workforce have been vaccinated, they can get together inside or outside without masks. Okay, there's still a risk of getting COVID even when you've gotten the vaccine. It's incredibly low. In fact, we have identified only 92,000 breakthrough cases in the nation, which is less, far less, 1% of the vaccinated population. So it's still incredibly rare to get COVID once you've been vaccinated. It can happen. And so we feel very safe that folks who are all vaccinated can hang out together indoors or outdoors without their mask. That's going to change some things around your workforce if you have pockets of your employees who are all vaccinated. If you've been vaccinated and you're outdoors and you're separated from folks that you don't know, okay, and you don't know their vaccine status, you can also take off your masks. So a lot of us have already been doing this, right? Going to outdoor restaurants and taking off our masks. Well, now we can feel a lot safer about that and some ease of mind if you've been vaccinated. If you have been vaccinated and you are exposed to someone with COVID directly, you know they have COVID and you know you were exposed to them, you no longer have to quarantine. And this is important as well as you develop your PTO policies and absenteeism policies, because those people do not have to leave work. They can monitor for symptoms for 14 days. And the likelihood is they are not going to be infected with COVID. So these are all wonderful reasons to get vaccinated. What we're seeing right now is those folks who were eager to get vaccinated, the supply is high enough now that they can get vaccinated, and that group has either been vaccinated, is in the process of getting their 2 doses, or is about to start their vaccination process. We have another group that we know feels very strongly against vaccines, and those are the folks that will likely not ever get the COVID-19 vaccine, although we can always try to encourage them to do that to reach herd immunity, which we'll talk about in just a second. But what we're finding now is there's a group that in the past we may have called hesitant, and there still are folks that have true concerns about the vaccine that we want to make sure they get their questions answered so that they can make the best decision possible for themselves. But more unfortunately, what we're seeing is folks who just have apathy. I'm not interested in going. I'm not necessarily concerned about getting the vaccine, but why bother? Some of that is just not wanting to take the time to get the vaccine. But one of the things that I'm hearing quite frequently from these folks who have vaccine apathy is that they think, well, what's the point? You know, I still have to wear my mask. I'm young. I probably won't get sick. Well, we've already talked about that, and that's not a risk, I'm willing to encourage anyone to take. But let's talk about the masking. Okay, we did talk about some situations where vaccinated folks don't have to wear masks. But what we're going to see as more and more folks get vaccinated is that those masking policies will begin to relax. We can't just flick this on and off like a light switch. Wearing masks is still a very important way to limit this pandemic, to limit the spread of coronavirus, because we don't have enough folks vaccinated yet. So once we approach that number, once we approach that herd immunity, you're going to be seeing more and more instances where folks feel like they can recommend, or we as individuals feel like common sense tells us we don't have to wear our mask. People tell me they have a hard time understanding exactly what herd immunity means and what are we trying to do by reaching herd immunity. So I'm going to share my screen for just a moment, and I'd like to share with you a graphic that you'll see really all over the place, but I think it's incredibly helpful to describe what we're going for here. Okay, so before we had the vaccine, you have a group of people, and maybe in this particular graphic, we've got two folks who somehow get infected with the coronavirus, and they spread it to those healthy folks, and then they spread it to additional folks, and they spread it to more folks, because we know COVID-19 is highly infectious, and suddenly almost everyone has COVID. Okay, we experienced this. These are the surges. This is what happened over the holidays, that kind of thing. Now you start to introduce the vaccine. So now we've got those same two people, same group of people, or let's say same number of people, but there's a smattering of folks in here who are vaccinated. And you can see here that, of course, there's plenty of opportunity with these unvaccinated folks for the virus to spread, right? But the folks who are vaccinated do not contract the disease. Now, one thing that's a little inaccurate about this graphic is that there will be a few more healthy folks who don't get the disease, because this person who's vaccinated couldn't really spread it, okay? So you may actually have a few more blue healthy folks in this diagram, but not many. Then you take a look at this scenario here where most folks, not all, but most folks are vaccinated, okay? And when you expose those people, or this group, to the COVID-19 vaccine, you can see everyone stays pretty much healthy. Only one unvaccinated person developed the disease. Now, these are just graphics, so we don't have actual numbers, but you get the idea that the more folks who are vaccinated, the less this spreads. Now you're talking about a disease that we manage, that we look for in the healthcare system, that we care for, but we're not talking about a pandemic. We're not talking about outbreaks and spread any longer. The problem is there have to be enough people to get vaccinated, okay? There can be a few folks who don't get vaccinated, and we can keep the population pretty healthy. But if there are more than a few folks, we're back to this scenario where the disease can easily spread. And so I caution people to say, well, if everyone else is getting vaccinated, I do not need to get vaccinated, and therefore I'm going to just take advantage of that herd immunity. Okay, everyone else is vaccinated, so it's not going to spread in the same way. I'll be safe. That's really not the best way to keep yourself safe. It's certainly not a great way to keep your loved ones and your neighborhood and your friends and your coworkers and community safe. And it's not a great way to put an end to this pandemic. So sadly, when we look, well, sadly, but also encouragingly, when we look at our South Carolina dashboard for vaccines, we are up to a third of our population that's vaccinated, and this is fully vaccinated, and that is wonderful. We're creeping up on half of us having some kind of immunity, so at least one shot, and that is also wonderful. But these are not the numbers that are going to get us to that third part of the graphic where the spread is limited, and therefore we can begin to unmask, we can begin to get together with loved ones, we can go back to mass gatherings like concerts and festivals and all of those wonderful things without worrying about folks getting sick. You can begin to develop some policies that look more like what you were doing before COVID. You can have folks coming together more often, not having to wear masks, maybe even throwing a back to school party or holiday parties again. Who knows if we can get this number higher. In general, folks, we say we need to hit about 70 to 80%. Remember that as we creep up, you will start to see some of those guidelines change. So it won't be that we have to wait necessarily until we get to 80% for things to start to look a little bit different, but they're not going to start to look more normal, shall I say, to us until we get to those kinds of numbers. So whatever you can do to encourage your workforce to get immunized is a great idea. We're going to talk about incentives and champions in just a second, but before I do, let me just again show you how you can get the vaccine and where you can point your employees. So you can go to our Prisma Health COVID-19 vaccine page, click on Get the Vaccine. That'll get you signed up in our system if you aren't already, and it will show you, it will show you where you can get the vaccines, where we have mass vaccination sites. I do want to point out that Prisma Health is giving all 3 vaccines now, including the Johnson & Johnson. At the mass vaccination sites, we're using Pfizer, we're using the Johnson & Johnson and Pfizer and Moderna in our private practices as we begin to stand those up as administration sites for the vaccine. But here are our mass vaccination sites. You can also go to the DHEC page. You see here, everybody 16 and above is eligible. Please bring a friend. Try to get as many folks as possible to get vaccinated. When you click on testing locations, it will take you to, those who've watched me before know I have a hard time with this part of it. Okay, it will take you to the vaccine locator. You can put in your zip code. It'll tell you exactly where you can get a vaccine. That may include a Prisma Health mass vaccination site, may include other healthcare systems, ambulatory practices, retail pharmacies, and so on. All right, so I'm going to stop sharing my screen for just a second and talk to you about some of the ways as employees you may decide to incentivize your employees to get that vaccine, because again, things are going to look very different on your business campuses. The more folks you have vaccinated, it's going to impact who can be close to who can meet, who doesn't have to wear a mask, who doesn't have to go home if they've been exposed to COVID. How do we manage outbreaks or basically stop the spread, because now you've got so many folks who are vaccinated. So it is worth your time to try to get your employees to consider these vaccinations. Incentivizing them is a tricky one, because we certainly don't want to punish those folks who have very strong reasons for not getting the vaccine, but we want folks who maybe aren't concerned about getting the vaccine, but have that apathy that we talked about, to get that little extra nudge, to get that shot in their arm. So we've seen folks give paid PTO for the time that it takes for them to go get the vaccine. We've seen folks give away CERSIs, essentially meal vouchers and gift cards, to those who have gotten the vaccine. As you have groups and work units and teams within your organization that get vaccinated, as they approach that 100% vaccination mark, maybe they're rewarded. Maybe they're rewarded by not having to wear masks, okay? Or by getting to have some sort of social hour, that kind of thing. But again, we got to be careful that our messaging doesn't alienate those who do not want to get vaccinated. I will say that in terms of nudging and in terms of getting the information to those folks who may have true hesitancy as opposed to apathy, champions within your system are really the best route to go. So I am more than happy to talk to your workforce and answer their questions. And I have done that with several organizations so far. We'd love to answer those questions. But what we have found to be even more powerful, or certainly in combination with that, is people who are influencers within your own organization. And remember, those may not always be the leaders. Those may be counterparts, colleagues, peers within the organization, within the workforce that have gotten their vaccine, who understand the importance of the vaccine and understand the science behind it. And we certainly can help them with that information. And using those champions within your organization to educate and nudge folks. Certainly coming up with transportation solutions and childcare solutions, if that is part of the logistic reason why folks may not be able to get their vaccines. And we have been working with businesses individually on whatever it is that they identify as a barrier and trying to help them overcome that and accommodate them, whether that's on site or through our mass vaccination clinics, helping them register, providing education, whatever it is you need. So as always, you can go to our webpage, Creating a Safer and Healthier Workplace at Prisma Health, and you can scroll down and you'll find a number. Feel free to call it. We can email, we can meet in person, whatever it is that you need. We'd love to answer your questions and help you as you transition through this time. I think the most important message I'd like to leave with you is that the sooner we get more folks vaccinated, the sooner we will be able to start re-entering the workplace or being in the workplace in more traditional type circumstances. So without masks, without fear of being too close to someone. That's what we're shooting for. So we'll help you do whatever we can to get the majority of your population vaccinated if that's what you'd like us to help you with. All right, hope everybody stays happy and healthy and safe, and that you all remember that we are here to take so you can take care of your workforce. And I will see you in 2 weeks.